Hi, my name is Croy. I'm the Director of Industrial Rehabilitation here at Oxford Physical Therapy. Speaking to you live from our Westchester office inside of FitWorks on Cincinnati-Dayton Road. Just wanted to give you a little insight on what all is involved with industrial rehabilitation, at least here at Oxford Physical Therapy. Industrial rehab programs involve return to work programs of physical therapy, functional restoration, and bridging that gap of an injured worker finishing up in physical therapy and trying to prepare to go back to their work status. So more times than not, most patients are either working light duty and on restrictions or not working at all, preparing for a return to work. So we take that next step in the physical therapy or the functional restoration process to where you finish up in a physical therapy program with a good level of mobility, strength, and function, and you take it to the next level where we come into these types of programs and we continue to full body condition. We start functional training and work simulation so that we can start training and preparing for a safe and successful return to work. That will involve full body physical conditioning and strengthening, as well as injury-specific physical therapy exercises that you may have already been doing in physical therapy, combined with cardiovascular conditioning, and then a work simulation component. If you've got a job to go back to, we're going to simulate specific tasks of that job to prepare for a return to work. If there's not a job to go back to and you may be entering a job search once your physician returns you to work, then we'll work on just basic functional restoration. There are a number of different services that we offer through industrial rehabilitation. We offer an active physical therapy program, which is that first step in the hierarchy of an industrial rehab program. That's going to involve, again, it's going to be very similar to your physical therapy program. It's going to last anywhere from an hour and a half to 2 hours, 3 days a week. And we will also do full body conditioning and very mild work simulation or functional activity. The next step in that hierarchy is a work conditioning program that is often used as a bridge to either return to work or prepare for a more intensive work hardening program. Work conditioning is typically 2 to 4 hours a day and 3 to 5 days a week, where we will, again, continue the injury-specific physical therapy exercises. We'll incorporate a full body conditioning program at a higher intensity level, and then we get into more functional restoration, more functional activities, more work simulation, again, 2 to 4 hours a day, 3 to 5 times a week. That final program in the clinic is a work hardening program, also known as occupational rehabilitation across our country. But this is that next level. And typically, you have to have either a specific job to return to simulate, or a job goal that has been identified by your case manager, therapist, and physician. But what we will do then is it's a little longer. It's roughly it's written as 4 to 8 hours a day, but typically 4 to 6 hours a day, 5 days a week. So it's more of a simulation of a schedule, simulation of job schedule and activity. Again, it's just that next level of intensity in the hierarchy. Still doing injury-specific therapy exercises, still doing physical conditioning, functional training, but it gets a little bit more specific when it comes to simulating job tasks and breaking down job function. The last service that we offer in industrial rehab in our clinics is a functional capacity evaluation. And that's essentially a 3 to 4 hour evaluation, may vary in time, but evaluation of full functional capacities. We will spend time in prior to those evaluations and understanding the medical background, understanding a job description, so that we can take a person through that functional capacity evaluation and give the physician uses this evaluation as essentially a functional diagnostic tool to determine whether that individual can go back to work, and if they are going back to work, are there restrictions necessary and what restrictions would be necessary. That functional capacity evaluation will help determine that.
Rocky, can you kind of explain or show us the items in our shot right here, how they're used during therapy and in the clinic?
Sure. And I know you've only got a small view of the clinic right now, but we kind of picked this location because, as you can see, we've got a push-pull cart right here that we use for push-pull function. It has bolts down each side of the apparatus as well that we use for sustained postural stooping, bending, kneeling postures. When working on that, you'll see in the background there's a vertical ladder that we can use. We also utilize that to simulate truck cab or forklift climbing. Up top we have shelving. We have a shovel station for our landscapers. We can dig and shovel up there. We also have a workbench up there with different tools that we can use for sustained reaching and functional activities. We also have a reach tree to the right of the ladder that we use for sustained forward and overhead reaching. Throughout the clinic, we have a number of different other pieces of equipment. We have a couple different lift stations that we can utilize for lifting and material handling practices. But up underneath the staircase, we actually have bolts up underneath each one of our stairs that we can work for our plumbers, overhead electricians. We also can get way up underneath the steps for those mechanics that might have to get to those awkward positions of lying on their back or kneeling and working above their heads. So a lot of our programs is really just finding the equipment. A lot of times employers will donate materials, used or damaged materials that we can utilize to simulate job tasks. But a big portion of our physical and functional restoration is we are blessed that we're inside of a FitWorks fitness facility that we can utilize 20,000 square feet of equipment to physically work on reconditioning the body, and then it's functional training and simulation of tasks that we will be creative. Each of our therapists, we've got a great tenure in our therapists and a great deal of knowledge of simulating job function, but we need to understand through the injured worker, the employer, supervisors, case managers, all team to simulate those job tasks the best we can.
Awesome. There are a couple people watching right now. If you guys have any questions for Rocky, you should ask that right now, or if you can think of any. Rocky, do you want to let them know how they can reach us?
Sure. We have a general number for Oxford Physical Therapy. Each of our clinics have a number as well, but we have a one call-in number.
It's okay. You can find it on our website,
Yeah.
but you can call 513-701-6100 or oxfordphysicaltherapy.com if you guys have any questions. Awesome, Rocky. Thank you so much.